A couple of weeks ago, I made a video regarding the OTC medication you possibly could use at home for COVID-19's outbreak. And in my videos, as we know, COVID-19 is ongoing pandemic, so there are lots of informations are changing on a daily basis. So my video also I will update that on the weekly basis. I cannot say daily basis, weekly basis. So if you want to know more information from my channel, you can subscribe, or otherwise you always can read news or those kind of things. So here I just want to make some correction on the previous video. And the first things first, I have to say is I'm not your doctor. I'm not giving medical advice. I only provide information, medical informations. So if you want to make sure all I said suitable for you, please talk to your doctor or pharmacist to make sure it do not interact with the drug, disease states, anything like that. And I'm not responsible for you taking this medication against your doctor's orders or your doctor's suggestions. Okay, so basically, since all my slides will be in Chinese, but also in English, I will make it very clear what's going on. Okay, first we're talking about cough medication. Cough medications, as last video already said, for all the cough medications, you want to loose up your phlegm, loose up your mucus. So basically, the first things, I always want to see your cough medication have something called expectorant, and the over-the-counter expectorant, common ones is called guanfacine. So do not look at those kind of brands. That's why I give you two different brands. Both brands, Mucinex, Robitussin, both have exactly something called a guanfacine, a single agent drug, expectorant. This is what made my first recommendation. But some people say if you just use expectorants, sometimes you cough even more, or you just cough constantly. So the second medication I'm talking about is a combination. It's guanfacine, which is same thing as previously expectorant. At the same time, add something called the dextromethorphan. Dextromethorphan is a cough suppressant. So when you add these two together, it will loose up your mucus and at the same time make you cough a little bit easier. And that's something different from the last video. Last video I tell you do not use dextromethorphan. This time I tell you the combination of these two is okay. But last video, there's another video I'm talking about drug toxicities, just like overdose yourself. So when you're using more than two agents, there is a very, then it's that like some drugs you have bottles have like 4 or 5 different agents talking about all different kind of features. Yeah, it's convenience. Honestly, it's convenience. But at the same time, you're running into a risk to overdose yourself. Even though you guys all speak English, the English much better than mine. But the problem is all those kind of chemical name, even for me, sometimes have a hard time to memorize that. And I think you guys may run into a similar kind of situation. So when the bottle have more agents, you have a more chance to mix up and causing overdoses. Like one brand and another brand, they have exactly the same agent, but you didn't really care for. You take them together, then you become double the dose. Okay, but I'm still believe if you just use dextromethorphan, I do not suggest that. Do not just use dextromethorphan, which is cough suppressant. Do not 100% suppress your cough. It's not the right things to do. You have to have something to loose up the mucus and let them cough out. That's for this COVID-19 or coronavirus. Second issue is the fever reduction. And that's another thing, big thing I need to talk about. Fever reduction, last time I'm talking about you can use Tylenol, which is acetaminophen, or Advil or Motrin or ibuprofen, but this time I make the correction because WHO and lots of professionals and after study they found out ibuprofen may not be a good choice, So the Tylenol will be the only thing we recommend right now. But remember, Tylenol is just a brand name. Genetic name is called acetaminophen, and the daily maximum dose is 4,000 milligrams, and for people with liver damages such as alcohol or some people have hepatitis or those kind of stuff, you may want to decrease that to 2,000 milligrams or talk to your doctor, see if that's suitable for you. Okay, your doctor may have different suggestions. And also the Tylenol, not only used for the fever reduction, you may also use that for headache, those kind of things. So you need to be a little bit careful. You may mistakenly think that's two different drugs. Actually, they're exactly the same thing. So you always have to looking for something called active ingredient before you taking the medication. So again, I say do not use ibuprofen, Advil, Motrin at this point until if the doctor or WHO found otherwise. At this point, all the recommendations said do not use that. Okay, and the next one is for diarrhea. Obviously, these times the coronavirus cause 3 symptoms: cough, fever, and the third one it will be diarrhea. For the diarrheas, I'm recommending Pepto-Bismol. Pepto-Bismol is just coating your stomach, make your symptom getting better, and it will not completely stop your diarrhea, because this diarrhea is caused by virus in your stomach. So you want to get rid of this virus and not just stopping it. If you just completely stop the diarrhea, the problem is it may come back even stronger, may come back, affect you even harder. And so that's not something you want. So Pepto-Bismol is something the chemical I recommended. And the things I do not recommend is use Imodium or loperamide. Loperamide is a diarrhea medication. It will just stop your diarrhea for a short period of time. And lots of time it's useful. If it's just like mild diarrhea, you stop you, it will be fine. However, for this time, I want to get rid of virus. So for me, I will not use that. I will not use Imodium or loperamide. And the last one, because of the diarrhea, you may lose lots of water or may use electrolyte like potassium, sodium. So that time you need to replace that. For replacement, I will recommending the Gatorade for the adults, Pedialyte for the kids. And you just don't drink the whole bottle right away. Just like small zips, like every 15 minutes. Every time, take about 1 ounce, 2 ounce, 3 ounce. Like slowly increase, make your stomach feel better. And if some people like warm, all those kind of things can warm it up before you drink it. It's totally no problem. So there I made a couple changes from last videos, and overall still relatively same. And I wish you guys can have a very safe spring, and we wish you guys have a wonderful time, and work together. We definitely can fight this disease, and everything will go back to normal. And thank you very much.